and it's very logical or natural to move to the next discussion. Mr. Terry, Ray Terry, you were just recently went through the screening cancer program, the cancer screening program that we talked about. Tell us about your experience. We're really anxious to hear about this.
Very good experience. I found myself after without health insurance. So the city of Louisville came through for me, and I went to the health screening around the city that had, and they did the screening part of it. And I told them I was diagnosed with colitis some years ago. So I came eligible to come to the hospital to do the colonoscopy, which was a good experience. The lady at the Cancer Research Center, Tina Harper, came through for me. She's a very good woman. This gentleman here came through for me, and Dr. Greg Stevens helped me out a lot. And they checked it out, and thank God it came out with a clean bill of health. Thanks to you guys.
So one of the things that was built into the program was what we call this quote unquote patient navigator, because you mentioned someone who came to talk to you.
Right.
Tell us about that interaction, if you would.
From Tina Harper.
Yes.
Well, she called me. She asked me, did I still want to do the health screening? Do I want to do the colonoscopy? And was I interested? I said, I'm very much so. She stayed in touch with me. She called me every day until the surgery was performed, and she just was a big help. She was a godsend, as well as you guys.
So what's really important about your being here, of course, in addition to the fact you had the colonoscopy, because people are watching this, and they may be, well, I don't know if I want to do that, because I know it's going to be hurt and painful and everything.
I didn't even know it had happened. I had took the medicine the night before. The worst part of it all was I had to go about 20 hours without eating solid foods.
Yeah, 20 hours. Well, that's a challenge.
But everything else went well. The surgery, I didn't know it happened. And the nurses at Baptist East were very pleasant people.
But that's just for clarity. Now, it wasn't surgery. You had colonoscopy. You had some kind of medicine, so you didn't.
I was sedated.
You were sedated, so when you woke up, it was all done.
It was done. I was in the room, and the nurses were there, and my family was there, and it was time to go.
And the results were?
Clean bill of health, smooth colon, no polyps.
Smooth colon. What does that mean to you? I mean the results are clear, but what does it mean to be able to say, I don't have anything?
I'm at that age now where cancer is a high probability. So when they checked and didn't see any polyps on my colon or any bumps, I mean, I was ecstatic about that.
And I think you mentioned something about a feeling of peace.
A great feeling of peace, because it means I may have a few more years left on this great earth.
And one of the things that happens to people is that some people say, I'd just rather not know. What would you say to someone like that?
You have to go check it out, because these guys, they'll help you out, and if there are polyps, they can remove them, take them off, and hopefully it can be okay and just resume a normal lifestyle.
Now, very, very important question. Did you have health insurance?
No, I did not.
And just why? What happened that you don't have health
insurance?
Well,
I'm a small business owner, and I'm sure it's a new business, and I just haven't, and the health insurance is just so expensive right now that I can't afford it with the new business I'm starting.
So thanks to this program, you were able to get the test done, no health insurance, clean bill of health, you feel at peace, you feel great, and you're very thankful. I really appreciate that. This is very, very important.
I appreciate you guys.
So Bill, as a colon cancer survivor, what message would you like to leave with those who are watching the show? What's the last thing you'd like to say to them today?
Listen to your doctor, learn about your health issues, and get screened.
Well, I want to thank the both of you for being here. We call this the Bill and Ray Show. Bill and Ray Terry.
And I'm alive.
You're alive. I want to thank you for being on the show.
Thank you.
And remember, if you are age 50 or older, get screened for colon cancer. If you're younger but have a family history of colon cancer, get screened for colon cancer. And do it because your health matters.
Metro TV, a public service of Louisville Metro government.